Welcome, everyone. If you're getting ready for your NHA phlebotomy certification exam, you are in exactly the right place. In this explainer, we're going to help you master the key body systems you absolutely need to know. We're going to turn all that anatomy theory into real-world practical action. So let's just dive right in with the most important concept. Your understanding of anatomy isn't just about passing a test, you know? It's directly linked to keeping your patients safe and making sure every single sample is accurate. When you get the collection right, the lab gets the results right. So here's our game plan. We'll break this down into 5 key areas. We're going to start with your exam and patient safety. Then we'll dive into the integumentary, muscular, and skeletal systems. And we'll wrap it all up with a review of the pre-analytical essentials. Okay, this first section is all about connecting the dots. We are going to link the body systems directly to the hands-on skills and the knowledge you're absolutely going to be tested on. Now, the NHA exam expects you to make these kinds of connections almost automatically. So, for example, you see the integumentary system, the skin. Its main function is protection, but for us, it's where we perform the venipuncture. Or think about the muscular system. Its job is movement, but for us, it's all about preventing errors, like when a patient clenches their fist. And here we go. This is a perfect example of the kind of question you can expect. They'll ask you to connect a system, like the urinary system, to its function, which is filtration, and then to a relevant lab test, like a creatinine test, which checks how well the kidneys are working. You've got to memorize these links. All right, let's move into our first deep dive, the integumentary system, the skin. I want you to think of it as your canvas. It's the place where the quality of your sample is either guaranteed or lost before it even makes it to the lab. Understanding these 3 layers is, well, it's non-negotiable. The outer layer, the epidermis, doesn't have any blood vessels. But the dermis, right below it, that's where the magic happens for us. It's packed with the capillaries you're targeting in a finger stick. Knowing this is how you choose the right lancet so you get a great sample without causing too much pain. This 4-step procedure, you need to know it by heart. You need to apply the antiseptic with friction, and you absolutely must let it air dry completely. Puncturing through wet alcohol doesn't just sting the patient, it can contaminate and break down the blood cells in your specimen, which totally ruins the test. And of course, once it's clean, don't touch it. Your eyes are one of your most important tools. A quick look at the patient's skin tells you what to do next. If you see jaundice, that yellowish skin, that sample has to be protected from light. See petechia, those little red dots? That's a sign your patient might bleed a bit more, so you'll need to apply pressure longer. And any site with swelling, burns, or rashes, it's a no-go. You have to find another spot. Let's be crystal clear on this. This is a critical error, both in the real world and on your exam. If you do either of these things, you're risking infection for the patient and you're destroying the quality of your sample. It's a failure on both fronts. Okay, let's move a little deeper now to the muscular system. This is where we see how a patient's actions and even their involuntary reactions can directly mess with the quality of your blood sample. So we have 3 types of muscles, and each one matters to us in a different way. Skeletal muscle is voluntary. That's what's involved in that fist pumping we need to avoid. Cardiac muscle is involuntary, and if it's damaged, it releases things like troponin that we test for. And then there's smooth muscle, which controls our blood vessels. When a patient gets nervous, it can cause a drop in blood pressure that leads to fainting. So here is a really crucial point. Telling a patient to pump their fist is an old, incorrect practice. That repetitive motion actually forces potassium out of the muscle cells and into the blood, which will make their potassium level look falsely high. It's a condition called pseudo-hyperkalemia, a fake result caused by a collection error. A single, gentle squeeze is all that's ever okay. Patient safety always comes first. Always ask your patient if they've ever fainted during a blood draw. If they say yes, or if they just seem really nervous, have them lie down. And learn to recognize those early warning signs, sudden paleness, sweating, or if they tell you they feel sick. If you see those signs, you stop the draw immediately and protect the patient. And here is another huge pre-analytical error you are definitely going to be tested on. A tourniquet that's left on for more than 60 seconds causes something called hemoconcentration. Basically, it makes the blood thicker and falsely increases some test results. Combine that with fist pumping, and you've created a totally useless sample. So remember, tourniquet on for 1 minute or less. That's the rule. Okay, now for our final system, the skeletal system. When we talk about this, our focus is all about safety and making sure we avoid injuring the bone during a puncture, especially with our tiniest patients. For infant heel sticks, protecting that heel bone, the calcaneus, is your #1 priority. The bone is so close to the skin, so you can only use the approved areas on the sides of the heel, and you must always use a lancet that's 2.0 millimeters or less deep. This prevents a really dangerous bone infection. And of course, always wipe away that first drop of blood. This is a classic exam question, so listen up. You can never, ever, ever use a lavender top tube for a calcium test. So why is that? Well, the additive in that tube, EDTA, works by binding to calcium. It literally pulls it out of the sample, which will make the test result falsely low and completely useless to the doctor. So let's just lock this into your brain right now. This is one of the most basic tube to test errors you can make. EDTA for calcium is an automatic fail, on the exam and in the real world. Just don't do it. Okay, we've covered a lot, so let's bring it all home with a quick, rapid-fire review of the most important rules that connect all these systems together. The NHA exam is absolutely going to test your ability to connect a specific action to a specific result. You have to know that fist pumping causes pseudohyperkalemia. And you have to understand that for a heart patient, collecting those troponin tests at the exact time they're ordered is critical for detecting a heart attack. And here's a simple little memory trick to help you get a great capillary sample every time. Just remember this phrase: warm, dry, still. Warming the site improves blood flow. A dry site prevents the blood from breaking down. And a still site lets a perfect little drop form. Warm, dry, still. If you walk away with nothing else, please master these 3 rules. They will prevent the most common and the most serious errors. Tourniquet on for 60 seconds or less. Let the antiseptic dry completely, and label every single tube right there at the patient's bedside immediately after you draw it. By mastering these principles, you are doing so much more than just studying for a test. You are preparing to protect your patients, to make sure doctors get accurate results, and to truly be an excellent healthcare professional. You've got this knowledge. Now, go and succeed on your NHA exam.